It is a brand new day. Good morning, Africa. Good morning, South Sudan. Hello and welcome to African Morning Breakfast Show, coming to you live right here on SABC from our studio in South Sudan, capital Juba. My name is Majur Cholkor, and in our today editions of African Morning Breakfast Show, we are going to look into health matters in the Republic of South Sudan, especially the health part of the women in the Republic of South Sudan. And under health of women in the Republic of South Sudan, we're going to talk about the importance of antenatal care in the Republic of South Sudan. Why do you think, as a South Sudanese, that our sisters, our mothers, our wives have to be taken care of when it comes to antenatal care? And joining me right here in this edition of African Morning Breakfast Show is Agnes Joan Silva, the Executive Director of South Sudan Nurses and Midwife Association of the Republic of South Sudan. Agnes, allow me to say it, I'm profoundly honored and exceedingly humbled to have this great opportunity to host you for the first time in African Morning Breakfast Show. Good morning and welcome to African Morning Breakfast.
Morning, and thank you. It's my pleasure to be here too.
Thank you so much for accepting our invitation to come to African Morning Breakfast Show. Before we look into the matters related to women's health in the Republic of South Sudan, your word of greetings to maybe your workmate, your friends, your relatives, people who are watching this program right now.
Yeah, I would like to greet all South Sudanese watching. Thank you very much. And it is my pleasure today that I'm going to share with you about the importance of antenatal care. And we are really, as South Sudanese, we have faced a lot in the area of mothers dying because of childbirth and so many related complications. So today we are just going to talk briefly about it. Otherwise, thanks for watching, and I pass my greetings to you all.
Thank you so much. And dear viewer, thank you so much for following us online, especially on SSBC TV. If you are following us online, wherever you're watching this program, remember to like, comment, and share, and we'll get to know what is your feedback out of this interview right here on SABC. And to my guest, Agnes, once again, welcome to the show. Now let's talk about antenatal care. Before we look at antenatal care, what is the antenatal care all about before we go deeply into antenatal care, for just a layman person to understand what does it mean?
Yeah, antenatal care is the care given to mothers during pregnancy in order to prevent or to detect or to treat complications, obstetric complications, meaning complications which may arise during the course of pregnancy. So simply that is antenatal care. The mothers come to the health facility and then they are examined by a healthcare provider, in this case a midwife, or sometimes a nurse, or also a doctor, and then to detect or to find that she's okay, everything is fine, and baby is fine, and she can move ahead well during that pregnancy.
So when are these procedures of antenatal care process started?
Yeah, actually it should start as soon as possible when the mother or when a person feels that she's, because when a person becomes pregnant, there are signs you start to become sick, maybe even signs and symptoms of malaria, including other conditions. So as soon as she feels not well in the body because of these changes, then she goes to the hospital. So if she's diagnosed, if she's found to be, the test shows that she's pregnant, then it has to start from that time. Actually, it's recommended to be at least 8 visits, but it could be more depending on the condition of the mother. But if all goes well, 8. So if you count 8 and the baby ideally stays in the months for 9 months, so, and most of the time they take at least 2 weeks before discovering that they are pregnant, or before going to the hospital and all that. So starting from that time, the sooner it is started, the better, because it deals with the health of the mother.
So how do the mothers go to the hospital or the health facilities? Is it their own decision, or they're supposed to make decision with their partners?
Yeah, actually it's the mother's decision. Okay, I can say collective, but the one who bears the baby in the uterus is the mother. If I am feeling sick, I cannot just wait for you to decide that go to the hospital or don't go to the hospital. I think this is just a human right, and it's just a basic right of the person. Like if you feel headache or something, you don't stay just and wait for maybe your father or your whoever is responsible for you to tell you, go and seek health care, right? So the same with antenatal care. As soon as the mother or the woman starts to feel that she's not okay normally, like something is not right somewhere, she might not be aware what it is, she has to seek medical help. Of course, with the support of the family members, the husband, and all others who are around. But the core responsibility should be of the one who is not feeling well.
Okay.
Yeah.
What are the health facilities that always mothers are supposed to go to for antenatal care?
Yeah, in South Sudan, we have the PHCCs, primary health care centers. All of them, the mothers can access this care. And also we have the hospitals. And also some private facilities also offer antenatal care. Not all of them, but at least the Ministry of Health, the primary health care in the state and at national level, at least this one, they're always offering the services.
Okay.
Yeah.
Now we want to come to the main sub-key agenda of why we want to know the importance of antenatal care. You have mentioned some part of it, but let's know deeply, because women are the caregivers in the community. Without a woman, no father, no husband, no what. So let's get to know from you, why is this stage of antenatal care very important?
Yeah, antenatal care is very important because it prevents this maternal death, I mean the deaths of mothers dying maybe during childbirth, when she's pregnant, or if she has just given birth, or even while she's giving birth. So it is very important because if she starts to follow it in the hospital, her situation will be known. For example, when she goes for antenatal care, there are tests which will be carried out to check whether she's medically healthy. And if she is not, it will be corrected immediately. And then she will be given some supplements like iron supplements and folic acid, because her blood level will be compromised, because these are 2 people in one if that is single baby, or even 3 in 1 if those are twins, or even 4 in 1 if those are triplets, and so on. So she will be given iron, folic acid, and other medications according to her situation, which are healthy for the baby as well. And then if she has also other complications, it will be detected earlier, and then it will be treated or corrected. And if baby is not lying well, and if there is something which has been foreseen that when she's going to give birth, it will cause problems, she will be advised accordingly, according to her situation. Even in other situations, she may be admitted to the hospital, and she's followed up closely. Or she will be told to come every week or every 2 weeks or every month, depending on her situation. So in a way to say that this is another way of checking, of ensuring that all will be well for you. As you have said rightly, I mean, pregnancy is actually a good thing, it's a good experience, because we women or mothers, we are helping in the creation of the world. We are helping in the regeneration. But in South Sudan, it has become like a death sentence. It has become a frightening experience when a mother is expecting a baby, when she's pregnant. And in fact, they even tell me sometimes, they say, you know, for us here, when we are pregnant, it's like one leg is in the hole, I mean in the grave, and one leg is outside. That is not a good expression, but unfortunately, that is what is happening, because the highest maternal mortality rate is in South Sudan. Now we are ranging at 1,150 over 100,000 live births. So that is why the women, the mothers are afraid. They are like, you know, when you're pregnant, one leg in the grave, one leg outside, meaning your chances of being alive is 50%, and this should not be the case. So one practice that could help us is antenatal care. The other unnecessary deaths, these are preventable deaths. They could be prevented. But if the mother doesn't come, the baby, nobody knows if she has enough blood. Nobody knows if she has other infections or not. Nobody knows how the baby is lying. Nobody knows whether the baby is 1 or 2 or 3. Nobody knows what else is happening in her, and so many other things. And then the time of labor, it will be very difficult for the healthcare provider to help. And worse still, most of them, because of other conditions that are other situations in South Sudan, most of them end up delivering at home. So it will even become worse. How can it be helped? For example, if she starts to bleed there, is there anyone who will help to arrest the bleeding and all this? So antenatal care is very, very important to prevent these maternal deaths of the mothers.
Okay.
Yeah.
Thank you so much, Agnes. And dear viewer, I believe you're following this conversation right here on SABC, whereby we're getting to learn more about why is it important for women to go for antenatal care or mothers to go for antenatal care services in the Republic of South Sudan. Remember, if you're following us on our social media handle, especially SSBC TV Facebook page, you can like, comment, and we'll be able to read out your comments or question right there. If you can be able to ask wherever you're following us online and offline from wherever you're following. Remember, this is African Morning Breakfast Show right here on SABC, whereby we always discuss issues that matters to you in the Republic of South Sudan. Right here from my guest, Agnes, we want to find out, being the Executive Director of South Sudan Nurses and Midwife Association, that means you have a lot of experience interacting with the nurses, the midwife, and also the mothers in South Sudan. So what has been your experience with these mothers when it comes to going for antenatal care services?
Yeah, my experience with these mothers, before being the executive director, I was also working in the clinical field. Actually, I was working at Juba Teaching Hospital and in other facilities. So we find that mothers who come for antenatal care are very few compared to all the mothers who are pregnant around in that area. Very few would come for the antenatal care. Of course, the mothers have their reasons. They have so many reasons. Maybe some of them are lazy, and some of them don't see the importance, and others, maybe the facility is far, they may not have transport money, and there are so many reasons. But the fact is that very few mothers, out of, let me say, out of 10 mothers who are pregnant in an area, maybe 3 would come for antenatal care, or if more, 4. And if those ones who come, they are not likely to finish all the visits. As I told you, it's supposed to be 8 visits or more, depending on the situation of the mother. But at least if worse comes to us, 4 visits. But you'll find that maybe she will come at the beginning, and then she goes and she stays, forget about it. And then when she's about to deliver, others, if they start to fear, or they start to feel unwell, like they don't feel well, then they will also come. So they might end up coming twice. And out of this, there are also few who are faithful, who would come at least 4 times. And we discover that those are likely to be educated mothers, like someone who has gone to school. Even if she has gone to school until P7 or P8 or even senior, not necessarily finishing university, she's likely to follow. And the graduates are likely to follow, but the graduates are very few. Those ladies who graduated in the university, they are likely to follow. Or if you tell them come every month or come every 2 weeks, they are likely to follow it keenly. So I can see that it's...
So just to interrupt you a bit, what make the people or the mothers who have never went to school to have that ignorance of going for antenatal services?
Well, I assume, because I really don't know exactly, we need to ask them to why they're not coming. But I just assume that maybe they don't see the importance. Maybe they don't feel that there is any danger related to it. Or, education is light. So for those who are educated, they are able to see, they are well informed. But those who are not educated, they are not. And they just feel like, it is just God. God will help me. If God wants me to die during giving birth, I will die. Everything is put on God. But on the other side, we are supposed to help ourselves. So they don't see this part of like, I will do my part, and God does his part because I have started doing my part. So it's connected to education, but as I told you, I'm just assuming because we did not get exactly why they are.
You find it out that sometimes, mothers who have been giving birth for maybe 1 to 2 or 3 kids, they'll feel like, okay, now there is no need for me to go again because she already know herself. And maybe it should be good maybe for the starting mothers, maybe born one, born two. So what do you say about that perception?
Yeah, exactly. Those mothers, we call them grand multiparas. Those are mothers who have already given birth more than 3 times, and then they feel confident because, you know, the more you give birth, the uterus relax and the labor time, the duration of the labor is reduced. She's likely, the baby will start to pain, and then she will not take long. She will just give birth compared to a prime gravida. Prime gravida is someone getting pregnant for the first time and going to give birth, of course, for the first time. So that one, the duration of labor is long. So these mothers here now think like, you know, they are now confident. They are like, I have gone through this experience and I have already known it 2 or 3 times or 4 times. So it's going to be okay. I can just deliver at home, even with the help of my grandmother or my mother-in-law or my sister or this. But on the contrary, they are actually at the highest risk. They are the ones we call them risk mothers, because they could start to bleed. Anything could happen. So actually, these are the mothers who should follow keenly. But on the other side, you find that they tend to relax because they have gone through this experience. And when you go through pain, you know, there is the first time you go through that same pain, you feel like it is more, and then the second time like it lessened, and the third time and even the 5th time is even more less. So because of that, they tend to relax. But these are the mothers who are actually
So what are they
in
supposed
danger.
to be doing?
They are supposed to come for antenatal care and make sure they deliver in the hospital, because they are actually in great danger because they have already given birth several times.
Okay, thank you so much.
Yeah.
Agnes, you have mentioned earlier that there have been high rate of mortality rate in South Sudan, the death rate, and we'll come and find out from you after this short break that what are you doing as South Sudan Nurses Association in South Sudan and the Ministry of Health and other health partners to making sure that this death rate when mothers are giving birth at the health facilities is reduced. And dear viewer, thank you so much for following African Morning Breakfast Show right here on SABC. Keep in mind, if you're following us online on our social media handles, SABC TV, like, comment, and share. And remember, if you have a question, post it there. We'll read it out for our guests to respond to your feedback. And after this far, let's have a short break. We'll be right back shortly. Welcome back, dear viewer. Thank you so much for following African Morning Breakfast Show right here on SABC. We continue to digest more about health issues in the Republic of South Sudan, especially from our gender side, that is female. We're trying to look out how women's taking part into visiting antenatal care services in the Republic of South Sudan. And helping us to understand more right here is Agnes Joan Silva, the Executive Director of South Sudan Nurses and Midwife in the Republic of South Sudan. Agnes, welcome back.
Thank you.
As we went for break, I did mention that once we're back, we want to find out the role that South Sudan's Nurses and Midwife Association is playing to making sure that all the nurses and midwife and the mothers, the high rate of death when they are giving birth in the hospital or health facilities is reduced. So what are you doing so far?
Yeah, thank you very much. So the role of the South Sudan Nurses and Midwives Association, SNAMA, in helping to reduce the maternal mortality rate We are really collaborating with the Ministry of Health in so many areas. First, we were doing capacity building trainings to our nurses and midwives, because let me say, if you graduate 10 years ago, medicine is updated, many things are changing. So we are trying our best to make sure that they are updated and they are able to offer quality service. And then we're also doing some other workshops to help them, because they are overworking. You'll find that there are 2 people in one facility and they have to attend to so many people, and they become stressed, and they will not be the best version of themselves, and they may not offer quality care. So we're also trying to make sure that we offer some healing sessions, though in a minimal size, but we are trying our best. And then also the Ministry of Health is collaborating with so many other partners together with us, so that we make sure that those places where there are no healthcare facilities, or for example, the healthcare facilities is very far, the mother may not access, we make also outreaches. Like you take the service to the people. A team of medical personnel comprises of doctor, clinical officer, nurses, midwives will go to the community and offer different services, including antenatal care. And also currently there is another new drug, actually 2. One is called heat-stable carbetocin. This one is for the prevention of postpartum hemorrhage, because it has also been discovered through the study that in South Sudan many of the mothers are dying because of hemorrhage because of bleeding after they have given birth. So, and then in other facilities we don't have electricity. So we have the other drug for prevention of hemorrhages and other things. It is, but it needs to stay in the fridge. What about other places where there is no electricity? The drug may not be effective there, and they may not even be able to keep it. So this new drug now, which can be taken now to deep down in the facilities where there is no electricity, is going to help us a lot. So that means the number of mothers dying because of bleeding after birth is going to be reduced. And then also we are creating this awareness, telling the mothers, please, if you are pregnant, come for antenatal care. So when they come, of course, they also find some unpleasant stays that they have to wait for long, because the healthcare providers are few. In these cases, the midwives, there are not many. So there might be 20 or 50 women waiting for these 2 midwives to attend to them. So it is not a pleasant experience to some mothers. But we say for now, because this is what we can do, let them just come like that. They come for antenatal care, so that if there is any abnormality, can be detected. If there is any other condition, it can be prevented. Or if there is already another complication or any other, it can be treated. Okay. So we are doing it through different ways to make sure that the number of mothers who are dying is reduced.
Yes. Yeah. These different ways now, let's go to the grassroots. You said medicine that is going to help the South Sudan Nurses and Midwife Association and the Ministry of Health and the health facilities to reach out to the grassroots. Now, the perception of mothers at the grassroots level might not be the same with the perception of mothers in the urban centers. So what are you doing as South Sudan Nurses and Midwife Association to influence the system, or do you have a traditional method that you always advise to the mothers or the midwife and nurses at the locals or rural areas?
Okay, so we are collaborating with many partners, different organizations, because this really needs collective effort. This is not only for one organization or not only for the Ministry of Health. So we are collaborating. What we tell them, we create awareness like in the community there, because majority of them prefer to give birth at home, but giving birth at home is also associated with all these dangers that we are now facing because of the same. So we collaborate with them. In the areas there, or in the villages there, we have these traditional birth attendants who are also trying their best. We also appreciate them because some of us have been born through the help of traditional birth attendants. So we really can't neglect or deny the help that they are giving. But what we are telling them is that, you know, they have limited, let me say, their skills may be limited because they have not gone through this other training, the other professional training. Much as they are helping, we encourage them to refer their mothers.
So do you help them with some skills in the process?
The traditional birth attendants?
Yes.
We have it in plan so far, which is going to be rolled out through the Boma Health Initiative. And then we encourage them to refer their mothers, because the mothers love them. We have to really admit this. The mothers love them, and I think they treat the mothers like queens. We can also adapt, we can even copy from them. They really treat the mothers like queens. So the mothers love them. So because the mothers love them, we need to be together with them, like you refer the mothers to the hospital so that all these other bad situations can be prevented. Then, of course, after the mother, or like in other localities, if they refer their mothers to the hospital, they are given a small token like transport refund, so that they don't feel like, I come to the hospital, how will I go back? And also they feel motivated, like small motivation just. So in this way, they are likely to refer their mother. So after, they will be following the mothers up properly. If the mother is sick, they tell the mother to come to the hospital. Even they accompany the mothers to come to the hospital. So this is, I think this will be the way to go, just to collaborate with them, because they are really helping the mothers, but you find that sometimes they are limited. If the mothers start to bleed, they cannot do anything. So if it is the baby is not lying well, they cannot do anything. They can only help when the baby is lying well, everything is okay, and then they can assist.
So Hagenis, there is this situation of unwanted pregnancy, whereby sometimes the young girls get pregnant without even the notice, they don't know, or sometimes it is unplanned. At the age of maybe 17, 16, 15. So what do you advise these young mothers? Because automatically, even if it is unwanted pregnancy, it becomes part of the nature, so they become mothers automatic. So what do you advise them?
It's true. So this issue of unwanted pregnancy, we have been discussing, and really in South Sudan, our dream is that all pregnancy should be wanted. All the babies, I have to decide that I want to have a baby, not by chance, because psychological is not even good for the baby. That's why we have this kind of people we have in South Sudan, because of the same. So our help is now we have family planning, or in this case, if it is for the youth will ask me, what family planning, because I am not even married, which family are you talking about? But we want to say there are ways in which we can prevent this unwanted pregnancy through different ways. We have natural ways whereby we help the youth to be able to read their bodies, understand their bodies. And then also we have contraceptive methods. If they fail in the other natural way, we also have contraceptive methods. So through this one, we shall really we shall make sure that all children, all babies are wanted, not by chance. And for example, if a person is raped, she may not want to have a baby with that man who really caused her all this trauma. So she will also be helped. So I think family planning, the modern contraceptive methods is actually good. Though in South Sudan we have different, perceptions, we have myths, we have misconceptions, we have taboos. With all this, when for example, I have been on family planning and I've given birth to an abnormal child, then everybody will say this is because of family planning, of the modern contraceptive methods. That is why they have distorted the shape of the baby. But just to say, even our great-grandmothers and fathers, we had some abnormal people in the community. And worse, even some communities were killing them. Was there modern contraceptive methods? What happened then? So it cannot be forced to family planning. To modern contraceptive methods. I think if we look at the developed countries, if we look at the developed, you can Google for yourself, just developed countries and Google their contraceptive prevalence rate. You will find that contraceptive rate or consumption goes together with development, because the mother is not likely to die during the course of pregnancy, and she's likely to take care of the other children. She's likely to space the children, and all the children are wanted, even if she has 7 or 10 or 5.
Okay.
All of them are
Let
wanted.
me pick
There is
from your
no
words,
child
Agnes.
by chance.
Let me pick from your words.
Yeah.
If all the child will be wanted, for example, a young girl of 16, 17 wanted to have a child, and the law said maybe she is still young, do you advise her to go for antenatal care services?
You are asking antenatal or
Yes,
or
antenatal
contraceptive?
care.
Okay, a young girl of 16, I am not advising you to have to conceive. You are supposed to conceive after 18. So if there is any young girl of 16 outside there and you want to give birth, please, it's not advisable. Why? Because anatomically you are not yet ready. Your pelvic bones are not yet ready. It's after 18 then that you can start to conceive. So of course when you conceive, antenatal care is just should be the course of the day. I don't risk to say mandatory, because it will be like we are forcing, but it is really a good practice. So whoever conceives, regardless of the age, even if there is a child of 11 years who conceived, she has to be followed strictly now for antenatal care, because she's even a risk mother in this case, because she's still a child who is going to give birth to another child, and the bones, the pelvic bones, are not yet ready. She is likely to have pelvic disproportion, meaning the baby may not be able to pass through the pelvis because she is still young, she is still growing. So it's advisable for anyone who is pregnant, regardless of your age, whether she is young or she is old. But when she is young, even she has to follow it more than the 8 times we say. And when she's even older, she should also follow it more than the 8, because these are the risk mothers we talk about.
So let's talk about the educations of the nurses and midwife that attend to the mothers at the hospital. You said earlier that you are offering trainings to nurses within different health sectors, especially at Juba Teaching Hospital in Juba. So why do you think that it is very important for all the nurses to acquire this skill, and how helpful is it when the nurses or the midwife are well educated?
Okay, so first of all, for us, SNAMA, we are offering the training for those who are qualified, okay? Because first, the other pre-training, we are not the ones offering. The Health Science Institutes offer for them to graduate to become either a nurse or a midwife. That is after 3 years, and the basic is 3 years, and diploma, then she will upgrade from 3 years diploma, then she will upgrade from there. So that one, SNAMA, we are not doing. But when they graduate, and then now they are in the clinical area, they are practicing, we now offer these other trainings, which we call professional, continuous professional development. Like her skills have to be, continually. You have to update him or her, and then more skills to come in, so that she become more competent, and she's able to offer quality service. So we do that one, of course, with the help of partners, because as SNAMA, we may not also, we are also in this same situation of South Sudan of economic crisis, and there is, but we thank God with the help of partners. In this case now we have UNFPA helping us, and then Canadian Association of Midwives also help us, and we have AMREF, and we are also in partnership with IMA and other organizations. So we offer this continuous professional development to improve what they already have, to just improve on what they already have, and they become more competent, and they become more confident, and also on the professional ethical part of it, because when you are always being overworking, you become unethical. You become annoyed with the mothers. You even want to, you say harsh words, and the smile disappears, and so many other things. So also we are trying to bring this back regardless of the situation. So this is what we are doing as South Sudan Nurses and Midwives Association.
So what do you say about students that are acquiring knowledge and skills from South Sudan Nurses Association, and maybe they graduate, and those who went for internship? For example, they came out from the university as a fresh graduate, and then maybe they're given to practice at an early facility like Juba Teaching Hospital,
Yeah.
are they supposed to attend to the mothers?
Yeah, under the guidance of the qualified personnel. This is how they can learn, because there are certain numbers of procedures that they need to perform. So first, in the college, they are taught theory, and then, of course, some parts of practice. They also do it in the college. Then now they come to the hospital or to any healthcare facility where they are attached. Then, through the guidance of the qualified healthcare provider, they will also be attending to mothers. So first of all, the healthcare provider, because they have already the theory part of it. So for the practical part of it, they have already done some things in the college. Now they are going to work on human beings, because in the college we don't deal with human beings. So now the qualified health personnel will now guide the student, and to make sure that the student is on the right direction, to make sure that the student is not going to cause any harm to the mother or to any patient or the client. So in this case of antenatal care, of course, there will be no any harm caused, because after all, it's palpations and examinations, withdrawing blood and taking it for tests and urine tests and other tests. So there is less harm which is going to be caused, but just to emphasize that they always do it under the guidance of the qualified staff who is already working in that facility.
Thank you so much, Agnes Joan Silva, for making it to African Morning Breakfast Show. Before we wind up this discussion, thank you so much, dear viewer, for following this African Morning Breakfast Show edition right here on SABC. We're talking about the importance of antenatal care. And remember, if you're following us online, especially on our social media handles, SSBC TV, remember to like, comment, and share, and also on YouTube and other SABC official on our YouTube channels. And remember, more will be coming to you right here on SABC. But before we wind up this discussion, let's find out some few challenges the nurses and midwives are facing in the country, and what support do they need from their government, the government of the Republic of South Sudan.
Yeah,
Agnes.
thank you very much. The challenges are so many, but I don't want to dwell on them, because when we talk of the law of attraction, we say likes attracts likes. So when we dwell on challenges, we are going to attract more challenges. But just to mention a few, first of all, our number is less. So as I already said before, you'll find that you are in the facility and you have so many people to attend to, and that one may compromise the quality of healthcare service. And of course, another one is the working environment. You'll find that I want to do so many things, but sometimes I may not have basic things, maybe PPAs or other things. Maybe sometimes even gloves may lack, or washing water or other things. And then sometimes also I will be working and working and working, and I'm tired, but I'm hungry. I may not afford to buy food for myself, not even for my family. So that one will make me compromise my work. I will not be coming every day for work, because I will calculate, like maybe I go 3 times to the health facility, then the other 2 times I do something else to raise some funds for my family or this. So as I told you, the challenges are many, but our country is still growing, and together with the Ministry of Health, with our government, we really want to change this situation, and I know we are capable. We can change this story. Let us put our efforts together. We are tired of all this. If we are getting the same results, that means we are likely doing the same things. So we have to start doing things differently. Let us just discover it, because why are we getting the same results? Why are we always broke? I mean, why are we always suffering? Why are we always dying? Why are we always this and that? So we have just to change the way we do things, and so that we get different results. So, but we are passionate and we are positive that things will change. We are trying to do our best, because if we look at ourselves from 2005 until now, a lot has changed.
Okay.
We have also to acknowledge that.
Thank you so much, Agnes, once again for coming to African Morning Breakfast Show. I know this is one of the most important questions that other gentlemen, a father, someone who is not married, wanted to know, that if antenatal care services is very important, what is supposed to be the contribution of the male gender?
Wow, the male gender is very, very important and very supportive. So first of all, we encourage actually physical contribution, like going together with your wife, if that is your wife or your sister or your mother even, accompanying her there. But in this case, mostly we really encourage the husbands, because they should be responsible. Because if I'm carrying this baby in my womb, I did not bring the baby alone. Someone contributed, at least donated something. So it's very important that the male involvement in antenatal care. And also we can encourage them, like if after they have come, we check, when are you going for your next visit, which time, which facility, and then also help them with, you know, facilitate the going. Maybe she may not have transport money, or she may not manage to reach there, and facilitate the going, and all the family to be supportive. And if you have time also, we encourage you go together, because it is once a month if all is well. So you can spare that time for once a month. Just go with her to give her the moral support, the psychological support, the financial support. And even your baby, by the way, your baby in the womb knows if daddy has come with mommy or not. Because what mommy is feeling, the babies feel.
Psychologically.
So psychologically, baby knows like, daddy is near here. So mommy is happy and daddy is with me and all this. So it is a good practice to encourage the women to go for antenatal care together with the partners. And if the partners cannot make it, but at least any male person, not necessarily your wife, if you have the wife of your brother, you can even go with her. You can go, because if the husband cannot go, or if the husband is not around, has travel, of course he cannot be here. So you can also support. We really have to encourage. If we need to change this story, if we need to change the number of mothers dying and all this, we have to change the way we do things. And this, the one they say, hey, mothers, these are female business. They say, these are women business. Who told you these are women business? In this world, both male and female, everything is male and female. This is how God created. Even look at the trees. They are all male and female. So it's not one gender's business. It only happens that the one who has the uterus happens to be the female part of it, but I mean the female gender, but it is the responsibility of all. Okay.
Thank you so much for all these kind of nice word for civic education to all the viewers of this program. Before I let you go, what could be a message to all our viewers of African Morning Breakfast Show?
Thank you very much for listening, and really concerning our topic today, antenatal care is very important. Let us encourage our sisters, our mothers, our aunties, our wives, our neighbors. If we see someone pregnant, it is a collective responsibility, because if anything happens to her, all of us are involved. Imagine if she dies, is it a one person's business? It's of the whole community, the whole tribe, even the whole neighborhood, all the neighbors you will be. So it is our responsibility. Let us, if someone is pregnant, we encourage her. We make sure she's happy. We make sure she's following antenatal care. We make sure things are okay with her. It is all our responsibility, because we are actually one. What affects the other person there affects us. So in this way, with this collective responsibility, we shall be able to reduce this many deaths, and we shall be able to give birth to quality children. Because we need to have quality South Sudanese. I mean, for this country to go ahead, the people in it should be quality people. So if the child in the womb is compromised because there is no blood, the mother is sick with malaria or typhoid or this, the child's health is already compromised in the womb. When she is born or he's born outside, it's going to be a sickly child. Is that one likely to be very intelligent child, genius baby? No. So it is our responsibility. Thank you very much, and it is our pleasure today to be in this African breakfast show. And I wish to appreciate all the administration of SSTV for this chance.
Thank you so much, Agnes John, for having your time and for the nice word, for the nice smile. And to the viewer, thank you so much for having your time to accompany us and listen to more of the insight of this discussion right here in African Morning Breakfast Show on SABC. Remember, we have been talking about the importance of antenatal care, and it is everyone's responsibility, either being a male or a female. Take what belongs to you, make use of it for the benefit of South Sudanese, for our mothers, for our sisters, for our wife, and everyone. And have a lovely time as you enjoy the rest of the program right here. Thank you so much. And Agnes, let me hope it will not be the last time for you to come to
this
FBC.
is just the beginning. Thank you very much.
Thank you,
Yeah,
thank you.
Yeah,
Thank you.
God bless you.
Yeah.
Okay, thank you.